Hi, I'm Dr. Kurt Woeller. When I'm asked to analyze behavioral issues in autism, sometimes I'm asked, innocently and legitimately, hey, is there anything we can do about this? Is there a change in diet or supplements that could help my child's behavior? And that's a legitimate question. But one thing I want people to understand is that behaviors in autism can manifest from many different reasons, but the behavior may be similar, right? Whether it's aggressive behavior, self-injurious behavior, often there's something that's leading to it, or there could be a combination of things that are leading to it. So I often look at behavioral issues in autism and try and figure out, is this some underlying biological problem? Is it linked to a food? Perhaps a child's reacting after they eat a certain food that they're allergic to. A lot of times that can occur, a couple hours later after a meal, whether it's breakfast, lunch, or dinner. Is the child behavior occurring while they're eating food? Sometimes that may just be the fact that they don't like the food, or the food is actually causing some discomfort. Once I had a child actually who was having severe reflux when he ate certain types of food, and it was manifest pretty quickly. And then there are chemicals in food that can trigger behaviors, sometimes hours or even days later. Okay, and so again, sometimes the food reactions are easy to pick up, and other times they're a little bit more challenging. So I look at that end of things. So I'm looking for biological reasons. The other thing about behavioral issues in autism is sometimes they can be related to gut problems. Constipation is a big one. If a child's not moving their bowels and they're uncomfortable, it's just like you or I, the longer you go, if you go days and days without pooping, well, it's uncomfortable. You feel pressure, you're bloated, it's crampy. Plus, in addition to that, there can be a growing amount of bacteria, toxins that are accumulating that also put pressure inside the digestive tract and make somebody uncomfortable, and that can lead to irritability, agitation, etc. So constipation is often a big one. The overgrowth of certain bacteria, clostridia bacteria, for example, can trigger behavioral issues by manipulating brain chemistry, dopamine metabolism, for example. And that's a classic one. In autistic kids, they often have an overgrowth of bacteria called clostridia. The way that that's best analyzed is through organic acids testing. The organic acid test from Great Plains Laboratory, for example, is critical to have done because elevated levels of dopamine can be a contributing or sometimes causative factor to behavioral problems, including aggression and self-injurious behavior. Sometimes the behavior is just situational. It only occurs at school. It only occurs at the therapy. Or it occurs either because they couldn't watch one of their TV programs or have their iPad or do something that they wanted to do. So there's a situational component that might happen. Some of it may be related to seasonal changes. I've seen this happen sometimes with an increase of allergies in the spring, where a child's becoming more reactive. They're more irritable and agitated because they're just allergic. So you have to look at behaviors and try and figure out, is it something physical? Is it something that's changed in their environment? Is it something that they're just mad and angry because they didn't get their way? And there's that aspect too. I've actually seen behavioral changes happen with kids because of siblings arguing, for example. And we know that autistic kids sometimes can't talk and express themselves, and so they get frustrated, and that frustration leads to, again, behaviors. So these are the things that we look for and try and decipher out. And these are things that you as a parent can also do and try to figure out, okay, is this, again, situational, continuous, ongoing? How is this manifesting? Okay, so just one thing to consider with regards to behavioral issues in autism. I'm Dr. Kurt Woeller. Thank you.